You're welcome to another episode of Fertility Talk with Olaronke Thaddeus. On today's episode, I will be discussing a very important topic. This topic actually constitutes 10% of the inquiries we normally have. And oftentimes I see this question, what IVF is. A lot of women still don't know what IVF is. And when I see this question, I'll be like, are you for real? Oh, you don't know what IVF is? Okay, so if you are in that shoes, if you are in that category, then let's talk about what IVF is and how you can benefit from IVF, and at what point in time should you consider IVF. IVF means in vitro fertilization. It's a fertilization that takes place outside the woman's body. You know, before you can get pregnant, you need to have sex with your husband, and fertilization will occur inside your body, and you will get pregnant, carry the pregnancy for 9 months, and you have your baby. Yes, that is the natural way of getting pregnant. But in the case of in vitro fertilization, your eggs are retrieved from your body, and your husband would produce sperm, and both your eggs and the sperm will be fertilized in the IVF lab and live for some days, like 5 days, to grow, after which it will be transferred back into your womb for implantation to take place. Immediately after the transfer is done, your doctor or your hospital will advise you to wait to rest for 2 weeks. Okay, that 2 weeks waiting period is very, very crucial after embryo transfer. Okay, so that's just the process of in vitro fertilization. So at what point should you go for IVF? That is the question. That is the question. Well, you'll find medical experts advising that after 12 months, if you've had consistent intercourse for 1 year, then you can decide to take a move. Visit the hospital and check whether there is an issue with you. Okay, so from my perspective, think it depends on your age. Okay, at what age did you get married? For instance, if you married at the age of 35, I wouldn't expect you to be waiting for 12 whole months before you take a move, knowing fully well that biological clock ticks very fast on women. Okay, so you can decide to set out for IVF right immediately if you tried for say 6 months and pregnancy doesn't occur. So you could decide to take that move. But if you're below 35, yes, you might want to wait for 12 months, have consistent intercourse, and see if you get pregnant. Okay. One of the major reasons why IVF is also done is because it's also helps men with low sperm counts. That is the truth. Okay, so if you are a man and you've identified, maybe you've done tests before, even way before you got married, and you have identified that, yeah, it looks like there is a low sperm count, you know, you can just decide on IVF right there when you get married, rather than wasting time. Okay, you need to be open about certain stuff, certain issues like this. You need to discuss with your wife that, look, I have a low sperm count, let's do IVF. Because IVF using a method of fertilization called in situ plamic sperm injection would actually enable your embryologist to pick the best of the sperm cell, okay, to fertilize the eggs that will be retrieved from your wife. The truth is that you don't need all the millions of sperm to fertilize your wife's egg. Okay, so using that method, each sperm cell can be picked through microscope. The embryologist will pick the best of the sperm cell. Okay, so you can decide on IVF if there is a low sperm count. In addition to this, you can decide to do IVF if you have issues with your fallopian tube. If your fallopian tubes are blocked, then you should consider doing IVF. Don't be deceived. I know there are a lot of herbs out there. I don't want to condemn anyone, but the truth is that once that tubes are blocked, I think what you need is a way out, something to bypass the tube, and only IVF does that. Okay, so for IVF, your tubes are not needed. Okay, only your ovaries and your uterus okay, are needed. Okay, so once you know your issues borders on fallopian tubes blockage, then you should consider IVF. Okay. Yes, another thing is that there are a lot of debate on IVF, success rates, and a lot of women would ask questions such as, what's the success rate? They want to know what success rate of the hospital or the center they are using, what the success rate is. Okay, so let me now bust your bubbles. Fine. Hospital A will tell you their chances is 50-50, B might tell you is 60%, C might tell you is 70%, D might tell you is 80%, but the truth is that the success rate of every IVF depends on 4 factors. That is the truth. And even judging, you can judge your matter yourself. Factor number 1 is the egg, the quality of the egg. The quality of the egg has to do with the age of the woman. Okay, if you are 38 and above, yeah, you have a very high chances of having your IVF work. Okay, another factor that determines if your IVF would work is also the quality of the sperm. Your husband has done semen analysis. How was the result? Was there issue with the sperm? Morphologic issue? Okay, when it borders on morphology issues, that means that's the make of the sperm. There is nothing anybody can do about that. Okay, so you already have this result. You can even judge your matter yourself. Then another factor to also for you to know if your IVF would work is your womb. How does your womb look like? You've done transvaginal scan, your womb has been scanned, hysteroscopy has been done. Ask your doctor, is my womb good enough? Is there issue with my womb? You know, and the 4th factor, I would say God factor. God factor is also there. At the right time, the right season, things will fall in place for you, okay? But of course, God is always good. But you see the other 3 factors, yes, they are very, very important. And to a very large extent, it determines if your IVF would work or not, okay? And the most beautiful thing is that, yes, all these factors can be sort of, if, for instance, the eggs are not okay again, you can decide to use a donor egg, get the egg from a younger female, or if the sperm is not that good, you might decide to go on some drugs before you start your IVF. If it is a space of azoospermia, you might decide to say, okay, doctor, if there is sperm in my testes, can you do a surgical sperm retrieval for me? You know, all these factors also can be looked at thoroughly from another dimension, and you know, holistically, the doctor will be able to help you to achieve the best of results. Of course, this hospital you're using also matter, who your doctor is, the lab matter, the embryologist also matter. Okay, I do say something that you don't have control over some of these factors, but the only thing you have control over is choosing the right doctor or right hospital to work with. Okay, so it's been nice talking about in vitro fertilization with you. I hope you've learned something. Thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more enquiries, kindly comment below. For consultation, kindly call the numbers showing on your screen. And for sponsorship, please call the number showing on your screen. Don't forget to subscribe to our YouTube channel. And if you love this video, kindly share. Thank you.